That is since 2017 to date. I know there are a number of people maybe who comes from ETTI. Even as we are speaking, there is one that is within this hospital. Then currently in CCC. So karibuni nyumbani, hatuwezi simama for a long time. So allow me to introduce my senior too.
My name is Richard Adede. We have been here since 2000 to date.
Yes.
Yeah, since 2000. I came here in 1999 December. So this, I know this is like the back of my hand. And so many of you have passed through our hands. But there's one thing we love with the ETTI. We have very disciplined children. No? We have very disciplined students. That's why we normally love your students. Yes. This is called Kisumu County Referral Hospital, the mother of all hospitals in Kisumu. You know, as social scientists, you have to get some background kidogo. Sindio? Yes. That is what we call sociology. Sindio? So basically, when we talk about Kisumu Referral County Referral Hospital, it started like it was one time a military camp. This hospital was a military camp. Only if you are keen, you can realize. This was a military camp. Then from military camp, you was in need that we need to have an hospital within the Lake region. So they resorted to this to be an hospital. That's why it is called Old Nyanza Provincial Hospital. The Old Nyanza were referring here, and bit of Kakamega and part of Rift Valley. In fact, it is older than Eldoret. It is older than Jotiare, Russia. Unaitwa Jotiare Jaramogi. It is nearly close to Kenyatta in terms of, yeah, this thing started a very long time ago. So basically what happens is that we do quite a number of things here. We do from community work to hospital work. Hospital work, by the way, I always tell people, treatment always is in 4 prongs. If you are a senior psychologist and senior sociologist, it is in 4 prongs, and then you are just summarized. We have physical, sindio? The one we do in the wards, sindio? By chemotherapy, by drugs. Huh? Then we have emotional, sindio? The one you are doing now here. Sindio? See, the one you are doing now here is called emotional. Sahi ndugu yangu, ukanyang'anywa kurudi nyumbani sahi. Upata samba yenu imeenda, utasoma kweli?
Hauwezi.
Halo, utasoma? Sahi kurudi nyumbani, si ndio? Umepata mamako hospitali na huna hata nduru. So the first person to look for is me. That's why we talk about from physical management, which is done by drugs, then we now go to emo. Then from emotional management, we now go to call psychosocial or psychological. Yes, you are okay, hauna uchungu yoyote kwa mwili, si ndio? Hauna ile ya moyo pia imetatuliwa kidogo, lakini school fee hakuna. That is now become psychological. And I always tell people, sociology is the backbone of every human life. Do you know that? What? Till now when they are pushed to the wall kabisa, sasa kuna pesa ya kutoa mgonjwa hapo. Sasa watasema ukweli, tena wanasema daktari, niko na shida, nataka tuongee watu wawili. Hata hapo bado pia anafeja tu, ako na shida bado anafeja. Daktari, nataka tuongee kidogo. Nini? Unajua sina pesa ya kutoa mgonjwa. So it means every human being like to be appreciated. It is only that corner that pushes to that world. And that's why as a social worker, As a community human person, you are very important, because all these things will backrest with you, because you will have these people with you in the society, and sometimes they will read your psychology, and that's why when we talk about patient counseling and education, it is very, very key in terms of social work also, because you have to read somebody's mind. You know, if you don't read somebody's mind, you will miss a lot, and that's why you talk about body language speaks a lot than verbals. Body language speaks a lot and a lot of honesty than verbals. Watu wanadanganya kabisa kwa mdomo. Lakini if you read the eye, if you read their body movement, how they behave with their body system will tell you mtu anadanganya. Mwe kuongea na mtu anasema hata huyo amtodanganya. Si ndio? Na amesema very positive things, sana hapana huyo amtodanganya, because body language speaks a lot. And this is what will happen what happens when people come to the hospital. Sometimes we just walk around and check. We do assessment. We say bwana huyu hataweza. Huyu ni honest. Huyu amekwama. Tuone vile tunakaa chini tunasaidia ndio nyumbani. And this will only happen if you are keen with what mwalimu is teaching you. You know, kazi yake ni kupea brain alafu atakwa. So if you don't utilize it well because he has a lot of vast experience about what they are telling you, you may miss it. So basically what happens, apart from that, why do we talk about psychotherapy? We're talking about psychotherapy because psychotherapy will make us understand human being. And this one only happens when you are a good and a smart social student and a community health student. So basically what happens is that here we deal with different people. Some have got mental problem. Na wamewachwa tu hapo, wamekuwa damu tu hapo. Si ndio? Mtu alikuja akawachwa hapo. We have a friend here who has stayed here since 1980. Amekaa hapa tangu 1980. Akutoa hapa psychiatric ward. Alipona kitambo lakini hakuna mahali pa kwenda. Ako hapo na sisi. Sasa tumeita mtoto huyo jamaa hospitali. But can we throw them away? No. Because the social aspect now tell us that this is a human being. As much as we did our work, it's now okay, but it's going where? Nowhere. The only home he's seeing is here. And he is adapted well with here than any other place. So since 1980, he's been with us here. And sasa amekuwa mzee. Na bado tunamweka tu hapo. You are looking at the social aspect. What if we throw him away? How will he start living field? Until you get right processes that can support him outside this, when you can throw them away. And that's why I know somebody will be asking, so mgonjwa amepewa discharge aende nyumbani, anaenda wapi? Sasa zingine anaenda wapi? Yeah, hakuna sisi hapa. Tuko now 3 months walipona kitambo, lakini no one is there for them. Tumewapea waiver, hakuna sasa hakuna boma ya kwenda. Bila alikuwa hospitali au watu walienda watu wakwa wakachoma boma ya hapa vizuri kwa nyumbani ama kwa sababu ya sasa watu walisema au ameenda amerudi tena amerudi tukutafuta saba nakata. So that's why when you are doing social activity, we have to be multi-sectoral. Don't just look at simple things. Yes, I know people might think about money issue. No, sometimes we also look at safety, their life safety. So that's why we talk about advocacy. We have to advocate for these people. Say no, these people cannot go home. I have a difficulty. Let them stay here because their lives are at risk. And that's why we talk of a humanitarian advocacy. And when you are doing advocacy, it entails a lot. It's not just you alone. Sometimes it will require legal issues. And legal issues require so many things. We have the paralegal team who is in the community. We have the normal justice team where the police and the judiciary is. But remember, these people, we have to work with them. And when you're doing advocacy, we'll say, apana, this person must get their right. They were sick in the hospital, but somebody may be with their belonging. And let this belonging be brought back to them. So how can we bring this? The paralegal team will take start the journey. Then we also take away, whereby we involve the police. And then make sure justice does what? Prevails. Because where there is justice, there is health. This mama yes, alikuwa hospitali, masemiji sake wamechukua samba lake, but we must get her back a farm, so that her life can continue with that child. That's why we talk of, you must do what we call strong advocacy for every individual. And when we talk about advocacy, we are just talking about how do we stand with the people when they are in trouble. How do we stand with people to give you security? Unasema right yangu, si right yangu. Si ndio? Si haki yangu, tunasema haki yangu. the haki yako will only come when there's somebody who is there to advocate for you and stand with you and tell you these are some of the right things you need to do. What you do. These are some of the procedures you can follow and lead you to somewhere where you want to what you want to achieve. You can do what you can achieve.
Maybe for this department,
you will get somebody to guide you, and that is part of you. Part of your, this is part of I'm talking with. This is part of training you. So when you talk about when mwalimu is teaching advocacy, you are coming na kungoja hapa nje, and you will now come to imply it directly. So you have to take it serious, because at time you will come and say now leo nataka uende kwa polisi report this case and then give us a feedback. Yeah, we just send you go and report this. Come with us with the feedback. We see where to start from. Okay, go to the ground. Look for us for any paralegal person around there, that place.
The role of a medical social worker many times. Remember, we understand what maybe social work is. Thank you. Because at the end of the day, we say that it's a process. You analyze someone's. I know you do case studies. Ndio, ama case works. We understand maybe perhaps the presented issues of the case, the client you're serving, sindio? Then from there you try to analyze it. You come up with the treatment plan, sindio? This case requires kama paralegal. Inafaa huyu mtu maybe perhaps is a GBV case, gender based. Kama ni gender based, what do we need to do? Of course alikuwa injured, sindio? When this particular person has been injured, treatment has been done, justice now comes, Where justice, we must look for a safe space, So role of a social worker, one, there is what we call psychosocial and economic assessment, What it entails about psychosocial and economic assessment, this is whereby we have to understand whoever whom you are serving, or whoever whom you are attending to. That means holistic knowledge of an individual to the extent that you know this particular person mwenye ametoka hapa, ameenda kwa ward, amepewa treatment, ndio at the end of the day anaenda wapi? It was given an example of a case we have here, ndio mental psychiatric. A big problem that I'm seeing, even yesterday we saw one of the medical interns, ndio ni uchungu, but anyway I don't want to talk about it because sometimes it's not easy. So you realize that as a medical social worker, especially to that extent, we might find out what exactly happened the other side. That is after you've known this patient X I'm dealing with, so many support. One of the support, even spiritual. 2, psychological, sindio? 3, the family support, which we call the social support. So when we talk about social support, that means in whichever way, we've seen cases whereby mtu huwa anangojeka mpaka wanasema no, enough is enough. It is not right for human being maybe perhaps to treat him that way or her that way. At the end of the day, anahitaji support. So under the social investigation, we have what we call home tracing, kuna what we call home visit, we also what we call follow up. You can only do a follow up to someone whom you assess. Hapa hivi, for example, huko mwicho psychiatric ward, mtu aliletwa na polisi, for example that case, when someone was brought to the maybe violent, destructive, alikuwa naribu vitu, you assume that this particular person maybe perhaps now is stable, unataka kumrudisha kule nyumbani. Do you think they are going to accept him easily? Of course no. That is why home visit is necessary. For example, hiyo ni surgical ward, watu wako na mahomes, maybe it happened because, I'm sorry to use that example, mtu alipigwa pale because alikuwa mwizi. When such scenarios happen, ameshatibiwa lakini sasa hataki kwenda kule, si ndio? Under social rehabilitation we have 2 things. Kuna reintegration, kuna integration, kuna repatriation, si ndio? When we talk about social reintegration, we try as much as possible to make this person now come out of the place. You cannot just do it one way that you want to do this thing. Kuna ile kitu tunaita pale kwa community gatekeepers, ama community entry point. Kuna local administrators. Because the safety of this person must also be guaranteed. Anapotoka hapa, mnaenda pale community, unajaribu ku develop the trust, ndio? Once that trust has been developed, you have a mind, because the patient wakati wanatoka kule nje, wakikuja kwa hospitali, there's a purpose why they came. And they always maybe wish wakati unawa handle kama human beings, because at the end of the day I happen to be among the GRM, yani mtu mwenye anasikiza the complaint within the hospital. So unapata like mgonjwa anakuja anasema ati vile nani amenifanya hivi, I will not come back again. You see such scenario. So as maybe perhaps whoever who I'm trying to find out what maybe perhaps could have happened that make maybe this person to feel the way she's feeling or is feeling. So once that one has been done, psychosocial support, that is contracting other things. There is what we call exploration stage. You try to explore. Exploration stage comes in a whereby now the client anakuambia the real problem amekuwa experience. Here is our maternity and NBU, newborn unit. You realize that mama aliletwa pale, si ndio? Mama mwenye aliletwa pale ilikuwa teenage pregnancy, si ndio? Sasa amenyamazia pale. Kumbe nyumbani there's no way she can talk about it. He was talking a case of paralegal. There was a case that we received 2 years also again here, where mwanafunzi aliamua kuzaa akastangle mtoto. Unaona such a case. It is so painful. So you realize that at the end of the day, what maybe the nature of this the patient we have here. Me, I once said something. One sociologist or social scientist, it is the only profession, just like I believe, can make me to understand someone better than any other profession. Better. Mgonjwa atakuwa analala kwa ward hapa.
Yes. Oh, my name is Nyanza. My name is Nyanza. Yes.
Okay, before I ask
yes. Okay. I'm a social scientist. Social scientist. Yes.
Okay, my first question goes like, as I have heard from your introduction, you say that you started working here in 1999. That was the year that I was born, by the way. It's amazing to me.
Yes.
I know most of us know that. And who was born at that year, who was born at that year. You see?
Yes.
It's amazing. So if like maybe we work hard,
yes,
we can even come and work together with you.
Yes.
So my first question is like, why did you decide to choose that career as a profession?
I want to make it, in fact, there are several things, but I want to only give you two. One, if you want to really understand human life, you will be a social scientist, because you will ever be working with the human life at a brain level. You will be ever working with the human life at physical level. You will ever working with human being at emotional level. You will ever work, in fact, even the aspect of some spirituality, you will be working with these people. And like somebody has just clinical medicine or damn nursing, who will only do the physical aspect ya madawa. Sindio? Me, I'll come sit down with you, start with your psychology. Sindio? I walk you and then cool you down. I come to your emotions. Sindio? I walk you and calm you down. Sindio? I come to your social aspect. Then I walk you and calm you down. Then I will tell you now, can you do a little bit of spiritual aspect? And it means by that end of the day, I've done 80% of management. I'm only leaving those for this for 20%. 20%. So it means 80% of care of a patient is with me. Two, simple one, if you are a human being who knows how to work with the society, you will do social work. Because society will be at your hand all the times. Sahi, ukiwa mdosi, si ndio? So wewe ni area MP sahi. Ukifika nyumbani, wangapi watakuja kutembelea wewe? Kwa sababu ya nini? Yes, kwa sababu ya nini? Sababu ya nini bwana ongea? Most of the say when you are an area MP, sindio, and then you go back home, people will come to you. 80% of their problem will be related on what? Social. Sindio? Not even physical. It is social work. Mimi daktari ataenda nyumbani akata kunya mwenye atamtembelea. No one will visit him. Sindio? Daktari will go home and no one will bother is there. But you enter, you will be there by night. By tomorrow morning, killer will know that you are there. Sindio? Because you are dealing with the social aspect of human being. So that is the 80% of human life, social aspect. Because social aspect will do emotional, psychological, even physical. Because once somebody has talked to you, you will give them some small money, sindio? You will go and buy food, sindio? After buying food, they will eat, they are healthy. Hunger imeenda, sindio?
Yes.
They are healthy. They will come to you, tell you, I have a child in the hospital who wants support, financial support. You will give them 200 shillings. They go pay in the hospital. The child is discharged. You are now part of physical care. That's why I said for me to live well in Kenya, I must be social scientist.
I want to tell him, I am a farm tech. That was the first thing I started with. Yeah. Then when I was doing my degree, immediately I finished my pharmacy. I got attached to one of the organizations here in Kisumu called Walter Reed. So in Walter Reed, as a pharmacist, some of the things that we were used to do, you could give drugs. to some of the participants. But where I got the interest and to go and do sociology, that is in Moi University. Something that came into me is that why is it that every now and again, once I'm done with this particular person, then there are those people who call themselves field assistants. Once I'm done, they always got inside this house, our household, because we kept on working also in the household. So it happened that one day we went to a certain household. Inside the house, you are seeing how the portals are there. Bear down. This particular person we are talking
one of the students
never took any supper or lunch. So it was my interest to ask this field officer, what is your profession? And what are you going to have a chat with this particular person once we are through? So when we were on our way back, he was giving me a history that this particular person that I was giving drug was saying there was no need for the drugs to be taken by her. Simply because I was dealing with a particular person who was underwent GBV yesterday night. I'm coming with a drug to be taken. So you find that my drug was taken because there is someone who was somewhere to have a talk with this particular person to understand why there was a need for. But there is what we call also gender mainstreaming. What exactly can happen once you underwent the same? We have got certain offices, some relevance bodies where you can be heard. So sociology made me to understand that at least it is not beyond. I cannot understand someone without social work. I'm doing it. I kept on telling people who, the student, whoever I have there, I will never regret why I'm a social worker in this hospital or in this world. Even a single. Okay. I kept on going to the county. I kept on forcing them. We must have a rehabilitation center in Kisumu. Not once. Because I understand what humanity is all about. So I'm very happy to be a social worker. Yes.
Okay. My second question, I understand now you are like almost 24 years in this career.
Yes.
So have you ever asked yourself that why did you choose this profession? Has anything amazed you in this profession since you joined this career? Or any challenge, maybe you talk to yourself that I should have not chosen this profession?
First, I want to tell that this is my 28th years in this career. 28 years in service. I started with Kenyatta. I want to tell you today, so many things have amazed me. If I can see somebody who was down, who was being denied justice, somebody could have been stuck in the hospital because no one could be there to understand them, that they don't have money, they're poor, and they can walk home, and then they come back to say, thank you for what you did to me. I went back home, I started my small business, and now I'm somebody. Thank you. Number one, happiness. Number two, I'm always happy all the time to that. Well, you just talked about about gender-based violence, the so-called defilement and rapes. You know, I'm just wondering, if we could have not been there, who could have stood with these people? Who could have gone to court tomorrow? Because I'm there, I'm able to go to court before that and stand with them. Since do you think 2019, I'm now it's a short period of time. If I could have not been strong enough, some people could have walked out, senior. But because of my profession and I know what I'm doing, I stick to my batons that justice must prevail. It is only DNA which was wasting our time, or which have managed to do what to do, and it has scored 99.9%. That shows that is a clear word, and that's what we are waiting for. Work closely with the teachers, because some of these young people, they are free to their teachers even to synthesis. They can easily open up to their teachers more than even the parent. And most cases of defilement, we normally capture them in schools. We capture them in schools. Mwalimu mtoto ataenda kufungulia around, will go open up to the teacher, and the teacher will come and give us the feedback. No, there's something going on here. Please, I want you to help us intervene. That's why we have to work with multi-sectoral. We have to work with the clergy. We cannot forget the clergy. There are some people who really trust their pastors and their bishops. Those are the only people they can go and open to. That nilifanyiwa hivi na hivi, lakini usiambie mtu. So the clergy will also use their brains smartly to share, so that we also give them these children.
Many times people have been saying that looking for attachment is a big problem nowadays. Someone was telling me the same. I believe that I don't know what maybe perhaps will be happening when I leave this hospital, but many of the things that happen is that for you to get an opportunity in this hospital, you just do application, once the application has been done. But the only thing I can advise is do the application in advance, not the same day that people are starting. For example, if it happened that you are to start as early as maybe May,
there's something more
apply by March,
so that for next week.
In the process, maybe around April, you always receive a call. I do a phone call by myself to many of the students, or maybe sending them a message. Your application has been
brought here when he was high mentally. Then those people dropped him, then disappeared without making any documentation. He was brought at night, akaachwa, wakasema wanaenda kata receipt wanarudi. Wakaenda. Hivyo tu.
So you've not traced even
the only thing he can say, he knows that he comes from Homa Bay. But exact home he cannot locate. The only thing he knows ni mtu wa Homa Bay. But actually he cannot memorize.
Okay, good afternoon. My name is Audrey Judith Chepkemoitowet, and I'm here for my attachment for a period of 3 months. I was assigned here, and we'll be here for 3 months, and this is my 4th day. And so far it's been fun. We've been able to interact with the patients. We've been able to go to various wards, and it's been really amazing. In our area of work as a medical social worker, we usually deal with the psychiatric patients, and that is our main area of focus, the patients with mental issues. So when we are here, our main objective is to understand these patients, use those therapies and the theories that we have learned from our various schools, so that we may help these patients to get well. So in these therapies, kuna vitu kama psychosocial therapies, we do psychosocial support. We offer them some therapies kama cognitive behavioral therapies, behavior change therapies, and many other therapies. So so far our interaction with those patients, it's been so fun, and as I can say, according to my personal view, they are really responding, and ni watu wako friendly. They love interacting with people really. Yeah, so
actually she's from Nakuru.
Yeah.
Ako hapa na mimi. So it is possible, si ndio? I believe in diversity. Watu wana exchange ideas, si kweli? So atakwambia hata tuko na wanafunzi kutoka different places. Now that watu walikuwa wameenda lunch, lakini yeye nimeona akiwa karibu, I decided to join us, si ndio? So let us feel free. Let us believe that it is possible. Sawa sawa. Thank you.
So once they are done, just walk. They get done.